Welcome to Peds Doc Talk TV. I am Dr. Mona Amin, a board-certified pediatrician and mom, and we are talking all about newborn rashes, what they are, what they look like, what to do about them, and so much more. This video is brought to you by the New Mom Survival Guide, an online digital e-course created by me to educate and empower mothers through their first year of motherhood. For more information, visit pedsdoctalk.com or visit my show notes for the link. Before we continue, make sure you hit that subscribe button because that's how you stay up to date on all of the videos I put out here on Peds Doc Talk TV. And here we go. I'm going over 11 common newborn rashes. I'm not going over eczema, hemangiomas, or diaper rashes in this video because I believe that those rashes deserve their own individual videos. So in this video, I'm going over these 11 rashes: Milia, Stork Bites, Mongolian spots or Dermal Melanocytosis, Neonatal Acne, Drool rash, Erythema Toxicum, Cutis Marmorata, Cradle Cap, heat rashes, Transient neonatal pustular melanosis, and dry peeling skin. Now, the last one is not really a rash, but it's one of the most common things I get asked in my office, so I figured I needed to put that on here. The first rash we're going over is something called Milia, which is actually really common, and it can affect about 50% of newborns. This looks like little whitish or yellowish papules or spots on the nose, forehead, cheeks, chin, or even on other parts of the body. But the most common place we see it is on the nose. This is caused by keratin, which is a skin protein that is very common in all of us, and in newborns we see it more prominently. These Milia spots will go away on their own. There's nothing you need to do about them. Don't scrub them. Don't rub them off. That's just going to irritate their skin more. It'll go away with time. I usually see it go away by the 1-month mark, but rest assured this is something extremely benign or not anything you need to worry about. Stork bites are really common, and they are flat, reddish birthmarks that we see on the eyelids or on the neck. They call it angel's kisses when it's on the eyelids and stork bites when it's on the back of the neck. It is very common, affecting more than 50% of newborns, and sometimes parents will report that they notice it a little bit later, like the 2-week mark or 1-month mark, but the reality is it was probably always there. It can just become more prominent before it fades. Also, when your child is warm, when your child is crying, you can see these look a little more prominent. It has to do with blood vessels underneath the skin causing that birthmark, but it is really normal, benign, so nothing to worry about, and it will go away on its own. For some children, it will last until adulthood. Now, this is something that will fade with time, but it is nothing to worry about and nothing you need to put on these rashes as they will go away on their own. So I have the pleasure of seeing so many newborns in my office. And of course, parents often come in concerned about their skin, right? This is the most common rash, quote unquote rash, that I would see, which is called a Mongolian spot or dermal melanocytosis. Now, Mongolian spot is an old school term. Dermal melanocytosis is the more medical term, but don't be alarmed if your clinician still uses that old school term of Mongolian spots. They are darker birthmarks, and you're going to see them commonly all over the body, but most prominently on the sacrum or the bottom of the back and above the butt. They occur in Native American, African American, Asian, Mediterranean, pretty much anyone who has melanin, which is that pigment that causes us to have that nice tan. Anyone who has melanin in our skin is more likely to have a baby with dermal melanocytosis. Now, we also see this in Caucasian babies as well, but this is something that's very benign, meaning nothing to do about it, and it goes away on its own. They can vary greatly in size and shape. In some babies, they're very small. In some babies, they can take over the entire back, but they do fade. Most of them fade through childhood. Some go into the teenage years, and in small, rare cases, we do see them go into adulthood. Although they do fade with time, this is something very normal and not anything to worry about. Neonatal acne is also a common rash of concern, meaning parents will come in super worried about this, and rightfully so because it can sometimes look bothersome when in actuality it is not bothersome to the baby. So it can affect about 20% of newborns, and they look exactly like pimples, that you would have in your teenage years. In babies, they don't necessarily have to have that big whitehead appearance. They can just be small irritated bumps, but you're going to know that there is inflammation. So you're going to see some redness around the papula or pimple. It's thought to be a result of an overdrive of the sebaceous glands in our baby's skin from maternal hormones. So they spent 9 months in a womb, and then they come out and they still have some hormones in them from you. So from that, they're going to have some overdrive of the sebaceous glands, which leads to more production of oils, which can lead to more acne that we see in newborns. Neonatal acne usually resolves by 3 months of age, and you're going to find that it waxes and wanes. Some days are going to be really great where the acne is non-existent, and other days you're going to see that it's more prominent. This also can lead to a mother feeling like it's them, like something that they're eating, but it really has to do more with the baby than with you. I don't really recommend elimination diets. If you are concerned, you can speak to your child's clinician to see if they recommend anything, but this is typically something that will resolve on its own without any intervention. In severe cases or cases that continue past the 3 months mark, sometimes we will prescribe a topical ointment, something like a benzoyl peroxide. This is something that can help eliminate that surface bacteria that can be causing acne, similar to getting acne in those teenage years. We also sometimes do recommend an antifungal. This is if it's looking really severe and looking more yellowish or looking more irritated. It's thought that maybe there may be a component of a fungus in neonatal acne, so sometimes adding an antifungal in those severe cases may help. My advice in education is usually recommending these prescription ointments only if it's severe, meaning causing the baby discomfort, or if the family really wants it for aesthetic reasons. If it continues past the 3 month mark, we definitely want to intervene with some ointments or some strategy here because it can have an increased risk of scarring. When they start to scratch their face after that 3 month mark and become more aware of the rash, we don't want it to cause any permanent scarring. So under 3 months of age, this is very unlikely. So we really don't recommend anything. But as a baby gets older, if they continue to have the acne, seeing a pediatric dermatologist may be of benefit to get an action plan to help reduce the appearance of the acne and prevent any scarring from forming. In mild cases, we also may recommend a topical steroid. This is again for a family who's feeling like it's persistently bothersome to them and they just want to help it with aesthetic reasons. My advice is that if it waxes and wanes, don't do much about it in the way of topical ointments that are being prescribed to you. If it is something that's severe and persistent, something to consider. There also are ointments over the counter that you can purchase online as well that are notoriously famous or popular for neonatal acne. Now, one of them, which I'm not sponsoring in this video, but is one that was recommended to me by many families, is something called the Tubby Todd All Over Healing Ointment. I'm attaching a link in my show notes if you want more information. Again, this is not sponsoring this product. This is something that I'm just sharing because it can help for many families, and I feel like if it works for them, I want to share it with you as well. Another reminder about neonatal acne, please don't pop them, scrub them, or rub them. Remember, that can lead to more inflammation and more irritation, which can in turn lead to scarring. So please try not to do that, as hard as it may be. Maybe when you were a teenager, you popped your pimples and whatnot, but really, please don't do it for your newborn. Don't do it for your newborn when they become a teenager. It's best to just leave it be and monitor and use any particular ointments that are prescribed to you if you need them. Drool rashes are really common, and similar to a diaper rash, it has a lot to do with moisture that can develop in those cute little neck folds or chin. What happens is when they drool or drink formula or drink breast milk, it can dribble down their chin and into their neck, and they don't have a lot of space in between their chin and their chest, so their neck folds can get into trouble with a lot of rashes, similar to diaper rashes. So I want you to manage it the same way. For those drool rashes, pat away any moisture, so any drool that you see, formula or breast milk, and use a barrier cream like Aquaphor Baby Healing Ointment or Vaseline, similar to what you would use in the diaper area. So when you do this, you're preventing any moisture such as drool or the liquids that they're drinking from causing irritation on their skin. So providing these barrier creams can be very beneficial. If you start to notice it look a little more red, similar to how you would treat a diaper rash, you can use those white ointments, the zinc oxide ointments, to provide more benefit to those drool rashes. If it's starting to look yeasty, so raised off the skin, looking like has texture to it that you can almost peel it off, then you want to use a topical antifungal or speak to your child's clinician for a prescription antifungal ointment. If nothing's helping from what I mentioned, talk to your child's clinician to make sure that you have the right diagnosis. Is it fungal? Does it need something else? Am I doing the right regimen? It's important to get the right diagnosis if anything that you're doing over the counter or at home is just not working. Erythema toxicum is a very common rash that affects anywhere from 50 to 70% of newborns. It looks a little similar to neonatal acne, but it is different. So neonatal acne usually presents at that 2-week mark or above, whereas erythema toxicum looks like a child was almost bitten by something. So it's a little papule with redness surrounding that papule, so a little spot. And it almost looks like they were bitten by a bug. And you're going to see it all over their body, usually on their chest, on their back. And it's something that also is going to wax and wane. Neonatal acne is usually something that's a little more prominent, more permanent, and affects largely the face. Erythema toxicum is very normal, but of course, if you notice that it changes in any way, if you notice that your child has a fever with them, definitely let us know. There are some rare rashes that can look a little similar to erythema toxicum, but a child will be very unwell, meaning the child would have fever, not feeding well. This is a very benign rash that will go away on its own, and it usually goes away by 1 month to 6 weeks with nothing to worry about. Cutis Marmorata is also very common, and it's something that can freak out a lot of new parents. It has to do with mottling of the skin as a result of cold temperatures. So you don't need to overlayer your child, but if you do notice it, put them in a footy pajama. It's very common on the legs or the arms. So just make sure you dress them in an appropriate amount of layers. I don't want you to go to the opposite direction and you put so many layers because you're worried about this, and then they develop a heat rash. So find the right balance with an understanding of knowing that this is something very benign, it's not harmful to the baby, and it will get better on its own. Cradle cap is another common newborn rash that really worries a lot of parents. Should we do anything about it? What should we do? Now, cradle cap is also called seborrheic dermatitis. It is characterized by greasy scales with erythema or redness surrounding them. Common areas will be the eyebrows and the scalp, and in some cases, it will go to the ears and the neck. Sometimes this can get confused with eczema. Now, eczema has more of a prominence on the cheeks, can be more red and dry, whereas cradle cap is more greasy in the scalp and in those eyebrows. And they're going to have that greasy scale that is very characteristic of cradle cap. Now, some babies can have both eczema and cradle cap, but they're managed a little bit differently. The exact cause is unknown. It's thought to be maybe something similar to neonatal acne, where it's overdrive of the sebaceous glands triggered by maternal hormones, or maybe perhaps related to a yeast called Malassezia furfur, which is a very common yeast that we can see on the surface of the skin. Infantile cradle cap usually resolves on its own, so there's really not much you have to do about it. In some cases, we can see it persist, similar to neonatal acne. Now, if it is bothering you or bothering your child, and for cosmetic reasons you want to help it, you can use things like coconut oil, where you massage coconut oil into their scalp and use a soft comb and comb away from their eyes. This can help break up the scale and dissolve it. If it still persists or it's becoming bothersome to the child or you can do tar-containing shampoos, or your doctor may recommend a prescription antifungal shampoo. Now, the reality is this is something that we do see get better. So less is more. If it's something mild and you can tolerate it and the child is not bothered by it, I would leave it be. If it's something that is bothering the child, where they're starting to scratch at it, get very irritated by this rash, then of course we want to help them. Treatment for cradle cap is usually cosmetic related. So if it's visually unappealing and you just don't like it, you can treat it. If it's not bothering the child, you don't have to do anything for it. And this leads me to just another comment about newborn rashes. They tend to bother us more than they bother the newborn. And in that situation, it's not bad if you want to treat it, but I want you to weigh your benefit and risk. Do I need to do all these ointments and treatment, or do I just want to leave it be? My advice is that if it's bothering your child, meaning they're starting to scratch at it, it's becoming very inflamed, red, open sores, looking infected, it's getting to that level, then maybe we want to get into a regimen of treatment. If it waxes and wanes, these rashes are not very prominent, they are just coming and going, you can just monitor it and maybe don't need to do all this skin therapy and ointments. The reason I bring that up is that I do believe less is more in baby skincare. You don't want to overdo things, especially on the face. Like I said, a lot of this can be an overdrive of sebaceous glands related to hormones, but we don't want to plug their skincare follicles and skin with all these ointments by using too much. So I do believe less is more, and coming up with a strategy that works for you and your family. Heat rash is also very common, also called malaria rubra, which is something that you may see on your discharge paperwork. That's like a fancy name to describe a heat rash, or prickly heat. This looks very different than Erythema Toxicum. This can develop at any point actually for your child, not just newborns. And it looks like little red bumps, and they're going to look a little irritated, but they're not going to look like pimples. They're going to be bumps that are so close together and going to look a little irritated as well. Now, this is caused by heat. So thought to be caused by blocked off sweat glands, right? So the skin does not have ability to breathe. So the sweat glands get blocked and it becomes these little papules that you can see. Now, the best thing to do for this is dress your child in loose clothing. For a heat rash, you don't want to put too many ointments or too many things to block the skin follicles and make it more irritated. So you really just want to dress them in loose clothing. Sweat, friction, and rubbing can also cause this. So dressing them in loose clothing, allowing their skin to breathe, just putting them only in a diaper can help. This is something that will go away on its own, so nothing to be worried about. Of course, if it's becoming bothersome to your baby, let your clinician see it so that they can see if there's anything else we need to do or if the diagnosis is correct. Transient neonatal pustular melanosis. Okay, that is a mouthful. And this can also look similar to neonatal acne, but the difference is in neonatal acne, we will see those papules with the redness surrounding the base. In this condition, it's going to be just papules that have no redness. It's very common in darker skin babies, and we don't know why, but it is something that goes away on its own. All areas of the body can be affected, but it's more common on the palms and the soles of the baby. For this, try also not to scrub and rub it. I tend to feel like whenever there's a rash on a baby, parents want to scrub and rub it because they think it's going to make it go away. But please make sure you understand that scrubbing and rubbing can cause more problems to their sensitive skin, and we just want to leave it be. The last one is not really a rash, but it's something I commonly get asked questions about, and that is dry, peeling skin, especially in your newborn that's under 1 month of age. Now, remember, your baby was in a water environment, the amniotic sac, for close to 9 months, if not 9 months. That is a water environment. They come out of the womb and now they have to be in a dry environment. Their skin is going to be peeling. It's like a snake skin. So you're going to see their skin peel and look so dry. We find that in babies that are post-dates, like 40 weeks, 41 weeks, they're going to tend to have even more dry skin. They were just in that water environment for so much longer. They come out with that extremely dry, peely skin. Rest assured this will go away. Like a snake, it'll peel off and their new skin will come showing through. You don't need to do anything for it. If it's bothering you, you can do a baby moisturizer. So again, nothing that has fragrance to it or dyes. You really want to use something that's mild and gentle for babies. But it is really common and it will go away without doing anything at all. Like I said, if it's not bothering the baby and it's one of these common rashes that is self-limiting, which means it goes away on its own, you really don't need to do anything about it. It's a matter of if you feel like you're bothered by it and you want to do it, understand, is it necessary? Do I need to do it? And you can do what you wish. The last comment I have has nothing to do with any of these rashes, but just in blemishes on newborns in general. I will find that sometimes you'll pick up a baby and you'll notice a rash on them. It may look a little bit like Erythema Toxicum, or just may look like your fingers on their skin. Remember, newborns have very, very sensitive skin. So it's not that they're allergic to you. It's not that they're allergic to your oils. They're just sensitive. So you could have used a lotion. You could have used something on you and you touched your baby and they broke out. You could have no lotion on your hands and just touch your baby and they break out in those little red blemishes. They are just reacting to the natural oils in your skin. They are super sensitive and it will get better with time. Their skin will not always be that sensitive. Now, by nature, some babies are more prone to having sensitive skin. This can be genetic, things like eczema, for example. But rest assured that less is more when it comes to skincare. We don't want to over scrub, over rub, and we don't want to over moisturize their face, especially in those newborn months, because we want to allow their skin to breathe. I hope this video is helpful. If you found it helpful, make sure you comment in the comment section. Make sure you share this on your social media channel and subscribe to Pete's Doc Talk TV, because that is how you're going to stay up to date on all of my content here on this channel. And I'll see you next time.